convening of the Central District Health meeting for Friday, January 28th, 2022. It is now 12 o'clock p.m., and this is a special meeting called, we did not have a quorum on our regularly scheduled meeting last Friday, so to be in compliance with regulations, this is within the 5-day window of having another meeting. So at this point, I will go ahead and call the meeting to order with roll call by county, starting with Ada County. Dr. Young.
Jane Young, present.
Raul Labrador.
Raul Labrador here.
Thank you. Dr. Cole.
Ryan Cole, present.
Thank you. Boise County, Commissioner Sturm. Don't hear a response. Elmore County, Representative Blanksma. Valley County, Commissioner Hasbrook.
We can't hear you, Elt.
Elt, we can't hear you.
Can you hear me now?
Yep.
Yes,
This
you
is
can hear.
Commissioner Hasbrook. Sorry, President.
Obviously, you are present and accounted for. Thank you. Okay, we do have a quorum, so I will proceed with action items of our agenda. Director Duke, are there any changes to the agenda?
Madam Chair, no changes to the agenda.
Okay, then proceeding on with new business. We have to have approval of our board meeting minutes from November 17th, 2021. If there are no additions or corrections to the minutes, I will ask for a motion for approval at this time.
Madam Chair, Ryan Cole, a motion to approve.
Yes, thank you, Dr. Cole. Is there a second?
Second. This is Jane.
Thank you, Jane. Any further discussion regarding those minutes? Hearing none, we'll call for approval by a county vote, starting with Ada County. Jane Young.
Jane Young, aye.
Raul Labrador.
Aye.
Dr. Cole.
Aye.
Boise County. No response. Elmore County. No response. Valley County. Commissioner Hasbrook.
Commissioner Hasbrook, aye.
Okay, thank you, folks. Those minutes do stand approved as presented. Number 2 under our new business agenda items is discussion on the designated operational reserve funds to fund our Nurse Family Partnership Program, which has been a goal of ours for years. Russ, would you like to lead this discussion, please?
Sure, Madam Chair. So what I am asking for is the board's approval to move money from our operational reserve fund, which, as you all know, has a good balance. We were able to build that up with a lot of the COVID funding we received, and many of our staff charged to those funding streams rather than the typical indirect rate, as an example. So we have the resources to do it, and I'm asking for the board's approval to move $200,000 from operational reserve into special projects. And the purpose of that money will be to allow us to start up a Nurse Family Partnership Program, which is a registered nurse, bachelor's prepared registered nurse home visitation program. It's been around for over 30 years. It's well-researched, evidence-based to improve everything from birth outcomes to reducing the probability of the infant that goes through that program, and of course the parents from ending up in juvenile corrections. So it's a wide range impact. We would like to get started on that upon the board's approval and build it out, basically a full program, what it looks like as a half-time supervisor, and then 4 bachelor's prepared registered nurses who will actually be visiting families, and they would serve between 20 and 25 families each on an ongoing basis. The program starts with the first time pregnancy, first trimester, And as long as the family is willing and able to continue through that child turning age 2. So I can provide more detail if you have any questions, but that's the overview of what we're asking for, and the dollar amount is $200,000.
Okay, Russ, this is Betty Ann. Would you just summarize how the program is to be allocated over the 4 counties, please?
Sure. So our plan at the start will be to have it based in Boise, and our Boise-based staff, just like we do for Boise County and to some extent for Elmore County, like with our environmental health specialists, the nurses will work out of the Boise office and serve the 3 counties. And then we'll have to work on a plan for Valley County. We're actually working with St. Luke's right now just because of the staffing challenges we've had up there, staffing our medical clinic. And we would look to do something similar to have the support to deliver the services in Valley County, but likely it'll be through a contractual relationship or partnership relationship where we'll be paying for those services on a likely a part-time basis due to the smaller population of Valley County. So that's our intent.
Okay, thank you. Discussion from board members regarding the program?
Madam Chair, this is Al.
Yes, El, go ahead.
Russ, just a little concern I have for $200,000. I'm not sure you're going to get that many FTEs, and I'm assuming that in the future, if we're going to grow this, you're going to be wanting more money for this program. I guess my thing is that is $200,000 enough to start that?
Madam Chair?
Yes, go ahead, Russ.
Yeah, thanks for the question, Commissioner Hasbrook. So the 200,000 is just truly startup funds. So we will be billing Medicaid once we start delivering the services. We also have a fairly large request for ARPA funds from Ada County that, of course, would be used for Ada County residents, and we'll also be seeking additional grant funding. So what you'll see, the budget that we will present to all of you at the April board meeting will include the ongoing funding to make the program whole. So the $200,000 is startup funding, hiring the staff, getting them trained, and then starting to see families. And we'll initially start with 2 registered nurses as the plan.
Madam
Thank
Chair,
you, Russ.
Madam
Yes,
Chair,
go ahead, Al. Yes.
Russ, I know this deals more with newborns and infants and that kind of period in a person's life. What I'm wondering is, because of the threats that's happening to our millennial fund, can some of those same functions be done by this nurse to talk to parents about tobacco cessation and to be able to use or show a use for those funds?
Madam Chair?
Yes, go ahead, Russ.
Commissioner Hasbrook, that's one of the things that we would definitely deliver as part of the services, would be discussing substance use, mental health, and tobacco use. Tobacco use, as you all know, is really transitioned primarily into using vaping devices, and that would all be included as part of the visit to help family members, not only the mom, but if there's other members in the home who are using tobacco and exposing the pregnant woman or the infant or young child, that would be of concern.
One more question, Madam Chair.
Yes, go ahead, El.
So Russ, could we also kind of figure out a way to fold in some of the opioid funding into some of these counseling services and processes? I think it'll be a kind of a combination as far as payroll and trying to figure that side of it out. But if we could kind of cover more with one person, I think that would make it easier to use some of the funds that are going to be a little tough later on.
Madam Chair?
Yes, go ahead, Russ.
The answer is yes. That's something we will definitely do. We're experienced doing that with a lot of our programs where we have multiple funding streams, and we have the different codes that staff would use to code their time to. So we can share more detail about what that'll look like at the budget discussion in April, but your points are well taken, and that is the plan. If we're spending time talking about tobacco prevention, and if we get the tobacco cessation money for this coming fiscal year, then we would have staff code to that. So it's this $200,000, like I said, is really just for the startup cost, but we're going to have to figure out sort of the more comprehensive business plan as we go forward. And it's not like we don't have ideas, we do. We just don't have everything in place just yet.
Okay, thank you, Russ. Any further discussion or questions regarding the program? Hearing none, I would ask for a motion to approve the program.
Madam Chair, this is all. I'll make a motion. We authorize the district director to spend up to $200,000 for a nurse practitioner program.
Okay, thank you, Elt. Is there a second for the motion?
Second, this is Jane.
Okay, thank you, Jane.
Moving the funds into special projects for the nurse family partnership.
Yes, okay, thank you.
Okay.
Any further discussion before I call for a vote? Well,
Madam
hearing
Chair?
none, we'll call. Yes, who's speaking, please?
Sorry, this is Russ. So yeah, specifically, I guess the motion probably would be stated as moving $200,000 from the operational reserve fund into the special projects fund. I just want to make sure that's clear that that's where the money's coming from. It's being moved from operational reserve into special projects for the Nurse Family Partnership Program.
Would you like Elt to rephrase that, amend it?
Madam Chair, I'll amend my motion to state that.
And I'll amend the second.
Okay, all right, thank you so much. Okay, Ada County, Jane Young,
Jane Young, aye.
Raul Labrador,
Aye.
Dr. Cole,
Aye.
Boise County, Commissioner Stern, I believe he's on. Elmore County, Representative Blanksma, she's not on. Valley County, Commissioner Hasbrook.
Mr. Hasbrook, aye.
Okay, thank you, folks. That motion does stand approved, and we'll get to rolling on that. It's been a long-term goal for us. Okay, moving on with our new business agenda items, we want to look at our 2022 regular meeting schedule for the Central District Health. And Russ, do you have anything to say before we go ahead with that?
Thank you, Madam Chair. Just a reminder that on the proposed schedule that you guys have in your board packet, that the May 20th meeting is when we do our budget hearings. That's a kind of a combination. You have the budget hearing first, and then we'll move over into the regularly scheduled board meeting. That will be in Boise County. Donna is working on securing space at the senior center in Idaho City. That's where we've done it in past years, and it's worked well. And now that meeting generally starts about 10 a.m. rather than the typical 8:30 start time. And then on June 9th, also on the schedule that you have in front of you, that's the annual Idaho Association of District Boards of Health meeting, which we will be the host of this year. And we are going to do it virtual per the board's request. So we'll be providing you with additional information soon on that.
Okay, thank you. Any discussion regarding this schedule for 2022? Well, hearing none, I would ask for a motion to approve the schedule for this year.
Madam Chair, this is Jane. I move to approve the schedule for
Okay,
2022.
thank you, Jane. Okay, is there a second?
Second, Ryan Cole.
Okay, thank you, Dr. Cole. Okay, any further discussion before I call for a vote? Hearing none, we'll go with Ada County. Dr. Young,
Jane Young, aye.
Raul Labrador,
Aye.
Dr. Cole,
Dr. Cole, aye.
Okay, Boise and Elmore County are not on. Valley County, Commissioner Hasbrook.
Commissioner Hasbrook, aye.
Okay, thank you. That schedule stands approved for this year. Okay, we do have our last agenda item is a discussion and vote of our new CDH employee handbook. Russ, would you lead that discussion, please?
Sure, I'd be glad to. So this is basically a product of House Bill 316 that was passed during the 2021 legislative session. We've talked about this at previous board meetings and the changes that will occur, one of them being our funding streams. Again, we can talk about that more at the March and April regularly scheduled board meetings, but the other part of that has shifted the authority, and I shouldn't say shifted, I would say it has clarified the authorities of this board and me as the director in collaboration with all of you to do things like setting the rate of pay for staff and determining the job positions that we have here at Central District Health. It will remove us from the state merit system and the state division of human resources. So that's what occurred essentially with House Bill 316. The implementation date of those changes is March 1st of 2022. So just a little over a month from now, that transition will happen both on the funding side as well as us not continuing to work under the state merit system and the state division of human resources. So what we've done, we have done this along with the other 6 public health districts, created employee handbooks. So it's essentially describing the circumstances, provisions that employees work under at Central District Health. The big change with this is we're no longer considered state employees for the purpose of the state merit system, the state personnel system. We are employees of Central District Health. And with that, our employees will become at-will employees. And essentially what that means is that there's the due process and things described in this handbook will be structured in the manner that we have made that determination to do, where there'll still be due process. Employees will still have the opportunity to make their case to me, but that next step will no longer be the Personnel Commission, which some of you may be familiar with that. They just assign it to a hearing officer if there's a dispute or an appeal, and then it goes to district court. Well, the Personnel Commission step would be bypassed. We no longer have access to that process. So this is our new employee handbook. We do plan to have each employee sign. They acknowledge they receive it and understand it, and then implementation date will be March 1st. I do want to share with you that we've been very transparent with our staff for a few months now, knowing this was coming. We have frequently asked questions on our internal website, our intranet. It's quite a comprehensive list. Things like, will I continue to have access to health insurance, group health insurance through the state, or will I continue to be a beneficiary of PERSI, our defined benefit plan? So that's all been done. We've also held 2 in-person meetings for our staff, and then we did a virtual meeting to make sure our satellite office staff in Mountain Home and McCall had the opportunity to participate. That was recorded and published for our staff to view. So I think essentially we're ready to go. As I noted, Gary Foote has joined us meeting virtually. If you have any of the kind of the technical questions. But what I am doing right now is requesting your approval for us to adopt working at CDH, our new employee handbook.
Okay, thank you, Russ. Any questions or discussion regarding the new handbook from board members?
Madam Chair, this is Al again.
Yes, Al, go ahead.
Russ, some stuff kind of going through my head here at the last minute, but like in counties, we have a name clearing hearing when someone is terminated. We have a lot of those appeal systems set up, and I haven't had a chance to get into the weeds to see if we've done that here. Would someone who has been terminated have that right to appeal to us before going further on up to district court? I hope we've set all that up, but I don't remember.
Madam Chair?
Yes, go ahead, Russ.
That actually it is included, Commissioner Hasbrook, and it's exactly what we're calling it, a name clearing hearing rather than an appeal process. So it's essentially like an appeal. They would come to me as the director for the name clearing hearing. So that's in there. And the one thing I also wanted to share with you, just for your awareness, is we worked really closely with Public Health District 3. Our handbooks look basically the same, and we work closely with our legal counsel, Mike Kane, and actually Mike is the one that brought that idea of the name clearing hearing forward, just to make sure we had that step included.
Okay, thank you, Russ.
Madam Chair, this is
Any
Jane.
other? Yes, Jane, go ahead.
Russ, I was just interested in what the employees were asking about it.
Madam Chair?
Yes, go ahead, Russ.
Yeah, so it's quite a long list of questions, but a lot of the concerns were more focused on things like vacation leave. Will I continue to accrue vacation leave at the same rate as I've been accruing vacation leave based on years of service? And as you know, that's in this employee handbook. We're not changing that. Sick leave is accrued at the exact same rate, and that's not based on years of service. It's 3.7 hours per pay period, so that will continue. Certainly concerned about using accrued sick leave to purchase health insurance, for example. If you were hired before 2009, an employee is allowed to use half of up to 1,200 hours, basically convert that 600 hours times your salary to be able to continue with the state group insurance. Trying to think what else. So those were kind of the bigger issues that came up, was more thinking about the benefits that we have today and will that continue? And the answer is yes. As a matter of fact, we're kind of in the final phases of signing memorandums of agreement with organizations like the State Controller's Office. It does a lot of our accounting and timesheets and payroll, and also the Office of Group Insurance. So those are the big items that I can think of off the top of my head that were of concern. And like I said, we've been able to answer those, and essentially nothing that seemed to be of concern was not resolvable or not going to move forward pretty much exactly as it has been for the last, 50 years since we were in 1970.
Thank you.
Sure.
Okay, thank you. Any further discussion and questions for Russ on the handbook? Well, hearing none, I'll ask for a motion to approve that employee handbook as revised.
Madam Chair, this is Al.
Yes, Al, go ahead.
Before I make the motion, I think that something that we need to discuss down the road, Russ and the rest of you, is the fact that I don't know if it's a wise decision to leave name clearing hearings and arbitrations and what I'm trying to think of the word, the financial deals that are made for people who are resigning or quitting. If we should be leaving that up to just Russ, not that I don't trust Russ, but I think or the district director, but I think it puts that person in a libelous position, and maybe should be a function of the entire board. But we can discuss that later. I'll go ahead and make the motion and to approve the employee handbook as written today.
Okay, thank you, Al.
And I'll
Is there a second to that? Yes. Oh, Ryan,
This-
you are on. Hi.
I am.
Thank you.
Yes, ma'am. I wanted to say I will second Russ or Elt's motion, but I also agree we should definitely be discussing that just so that that doesn't fall directly on Russ's shoulders.
Okay, thank you. All right, the motion has been made and seconded to approve the employee handbook as presented today. Any further discussion? Well, hearing none, we'll go ahead and call for a vote by county, starting with Dr. Young.
Jane Young, aye.
Raul Labrador,
Aye.
Dr. Cole,
Ryan Cole, aye.
Boise County Commissioner Sturm.
Commissioner Sturm, aye.
Okay, Elmore County Representative Blanksma. I don't believe she's on. Valley County Commissioner Hasbrook.
Commissioner Hasbrook, aye.
Okay, thank you, folks. All right, that employee handbook has been approved, and I thank you, folks, for your participation in all of these items today. That does bring us to the conclusion of our agenda. Thank you to the public that's listening in and to the staff that made this meeting possible. Our next regularly scheduled meeting is March 25th at 8:30 a.m. So at this time, we'll ask for a motion for adjournment.
Madam Chair.
Ryan Cole, motion to adjourn.
Yep.
Thank you, Dr. Cole. Thank you, Dr. Young. We'll go ahead and call for a vote by county, starting with Dr. Young.
Jane Young, aye.
Raul Labrador,
Aye.
Dr. Cole,
Ryan Cole, aye.
Boise County Commissioner Sturm,
Commissioner Sturm, aye.
Elmore County Representative Blanksma, Valley County Commissioner Hasbrook.
Hey, good to hear your voice, Ryan. Aye.
Okay, thank you, folks. Our meeting does stand adjourned, and everybody have a wonderful weekend. Thank you so much. Bye now.
Yes, everyone take
Thank you,
care.
Madam Chair. Thank you, everyone.